Welcome, everyone. Thanks for joining us. It's really a pleasure to be here. We've assembled four of us, supply chain nerds who are really committed to getting products to people where they need them. And we're happy to be here with you. If you're here in the live with us, please write into the comments where you're listening from, your name, so we get a sense of who's on the call. We are on the live video with us today. And then later, if you have questions as well about any of the topics we touch on, please go to the International Association for Public Health Logisticians discussion platform. And there's a subgroup called the Humanitarian and Commodities Logistics Forum. And you can sign up there and we will answer your questions there. And we promise to be there with you and follow up so that you can get all the answers and information you need. We're really happy that you're here. This is the fourth in a series of conversations on global health supply chain practices. And we're this time going to be focusing on how to manage health commodities and supplies in humanitarian settings. We're really lucky to have the support from the USAID Bureau of Humanitarian Assistance to work on this project. And the purpose of this project is to build the capacity to improve pharmaceutical and medical commodity management in humanitarian and disaster settings. We work with a lot of those NGOs that all of you know, the big NGOs that respond to humanitarian disasters, and we support them to strengthen their ability to manage those pharmaceutical and health medical products, which has been a big deal this past year or two, now that the whole world supply chain has been impacted. So today we're going to be talking about a series of webinars that took place over the last several months on quantification of health commodities. We're going to talk about how to plan and estimate for products in an environment where you might not know how many people are going to be affected by the disaster. We're going to talk about managing kits a little bit. And then we're going to talk about supply planning, which is the process that you do after you estimate your amount so that you know that you actually procure how much you want, because that's an extra step that often people leave off, and then you end up with way too much or way too little product. So this is what we'll touch on today. We won't go into great detail about what these webinars were about, but we will give you a little taste so that you can then go see the webinars yourself, which are going to be also at the links that we included. You can find all that information there. So here I have my colleagues who I've worked with for a long time, and it shows how much we like working together. We have Barbara here, Greg, and Layla. And I'll introduce each one, and then we're going to have a Q&A, and we're going to talk back and forth so you can get a little taste of what we do and how much we care about what we do. So first we have Barbara Lamphere. She's a senior technical advisor, and she works a lot on organizational strengthening. So she really thinks big picture about how organizations can improve really at the greatest level to improve their functioning and then also their capacity in specifically supply chain management. She has designed strategies and techniques to improve health manager and provider competence. She's established in-person, but also a lot of blended and distance learning programs, which have really come into good use this past year. And she's developed initiatives to support and motivate workers. She's very person-oriented, and that's been a great asset to us here at JSI for a long time. She also worked on the former USAID Deliver project that many of you are familiar with. And a lot of these learnings come originally way back from then, but have been improved over the decades, and really now we're doing some more innovative things as well. Gregory Roche, who is also senior technical advisor, also a real strong expert in organizational strengthening and capacity development, a supply chain professional as well, and has a lot of experience in program management and individual and organizational performance improvement. Also a lot of human resource development, logistics system assessments. And Greg has participated in supply chain improvement, both in English and in Francophone countries. And so he's our go-to often when we want to include the French speakers. And he has developed and conducted distance learning activities as well. which has also come in handy this past year. Finally, we have Leila. She's a senior technical advisor at JSI and has worked also in many countries and regions. And she's really our pharma expert. She's a PharmD, and she has this specific capacity to do both system strengthening, but understanding the nuance of that in pharma and health commodity focus. She received her Doctor of Pharmacy and Master's in Public Administration. And also she has a MicroMasters in Supply Chain Management from MIT. So not only is she a strong pharma expert, but she also is a strong supply chain expert with a lot of these newest innovations that we have learned from MIT. So without further ado, I should also present myself. I'm Nadia Olsen. I'm also Senior Technical Advisor at JSI. I've been working in health system strengthening and supply chain strengthening for a while. I work a lot in humanitarian and fragile settings, and so I'm considered JSI's lead for humanitarian and fragile setting work. We work in the nexus of the humanitarian and development world, so we're not there to be a first responder, but we are there to work with others who are first responding, and that's why we love this project, because we really support those that are at the front line of those responses so that they can do a better job, and it's a great complement to our skill set. So my first question is to Leila. Leila, can you talk to us about the importance of quantifying health commodities in humanitarian settings and what's the specifics of that? And we'll get more into it as we have this discussion.
Sure, thanks Nadia, and thanks for the introductions. Well, the purpose of quantification, which is two things: forecasting, determining what your demand is, and supply planning, how much and when to buy so that you have adequate supply. You don't have too much that it goes to waste, and you don't have enough to meet the needs of your population. So in a perfect world, you have an agile and resilient supply chain, and when an emergency or a crisis hits, you adjust, you adapt, you figure out what to do, and you can still meet those demands. But oftentimes you don't have enough data, enough information, because everything has changed. And that's why there's the kit system. So kits have been developed by a lot of different organizations internationally to meet general context, not specific to that particular site or condition in terms of demographics or morbidity or disease patterns, but they're there to be deployed as soon as needed in an emergency setting. And it really requires very little data to do that. And so you just need a basic set of information, figure out how many kits you need, and then you get them deployed to your setting. But because they're not general, they're not specific to your context, they don't often meet the needs for that particular situation. And they're not meant to be used long-term. They're meant to be used just for the emergency until you can start to collect the necessary information to figure out what you do need. And products will go to waste or you have overstock. What we did try to do, I went to Cox's Bazar in Bangladesh a few years ago to help with a UNFPA office there with their Rohingya population work, to transition them away from the kit system to figuring out and quantifying how many unique individual items they would need if they went away from the kit system. And it required a lot of different steps. We did some capacity building, figured out what actions needed to take place before those procurements of individual items took place.
Great, thank you, Leila. And I think you're touching on, you have to change your quantification approach depending on the stage of a disaster. And so Barbara's going to talk to us a little bit too. I want to ask you, Barbara, how does quantification for health commodities in emergency response differ from quantification in a more stable situation?
Yeah. Well, the principles and steps in quantification are basically the same, but there are some key differences when we're dealing with a humanitarian response. Those key differences, I think, are really related to data availability, the timeline for planning for and for funding of procurement, and then, of course, the use of kits that we've just been speaking about here. And so Leila mentioned in terms of the data that's available for forecasting. So in the acute phase of the emergency, when an emergency is just happened, the data that might be available to have us maybe an estimate of some of the target population data, some of the demographic data, but the consumption data that we would usually rely on for forecasting is it's generally not available until later on in the emergency. So that's a key difference, is that data availability. And maybe later in the emergency, during the protected phase, when routine reporting has been established, then we might have more availability to use consumption data. But that change in data is definitely a difference between the two settings. And then in terms of the donor commodity funding and the timeline for that, usually the spending timeline is shorter in a humanitarian response. And there's a lot of uncertainty in terms of how far out how long the humanitarian crisis will last. And so when we're thinking about how far out to forecast for and how far into the future we would make our supply plan, those are very nebulous and always changing. And I think that those things add to the challenges. But what this points out, just as in a stable situation, is the real importance of continuous pipeline monitoring and flexible procurement because of these uncertainties, because of the changes, because of the receipt of new data that will change your forecasts throughout the crisis. So you need to have that flexibility both in terms of your procurement, but also and to really reinforce the need to have that continuous pipeline monitoring as much as possible. All of this really just emphasizes a point that Layla's brought up, I think, as well, is that what we need to do is really strengthen our existing supply chains so that they can respond to crisis when they occur, as well as to function efficiently in a more stable situation. We've talked about kits a little bit already, and Greg, I know that you've done research in this area. So can you add some of your thoughts about quantification for health kits when they're used in emergency settings and expand on that a little bit more?
Sure, Barbara, thanks a lot, and hello, everyone. So one of the things I just want to mention, just to give a basic understanding of kits, is that you've got these kits that are intended for emergency services and emergency cases. You've got different kits that are designed to treat different health conditions. So you might have one kit for cholera treatment, one kit for malaria, or even a variety of kits for malaria. You might have the basic cases and the advanced cases, or and then you've got like reproductive health kits that can be for all different things. You could have post-rape treatment, you can have STI treatment, you can have basic contraception, like that. So you've got the different kits for the different purposes. And the main thing that we need to know or keep in mind is that all the kits generally are based on population. So they'll say, for example, the reproductive health kit that's intended for the treatment of STIs is intended to treat a population of 5,000. And different kits will have different target populations. Then within that, each kit is going to be designed to treat a certain number of cases within that category. So for STIs, you might have genital infection, for example. And one of the statistics that they'll use is to say, for example, out of this population of 5,000, we expect 20% of that population to have this infection. And so we give you the products that are intended to treat 100 people in that case, 20% of 5,000, treat 100 people for that health condition. The challenge, of course, is that those are based on general averages of disease incidence. So your country might be different. You might have a lower incidence, you might have a higher incidence for any particular health condition. And so in those cases, at the same time you're quantifying the kits to know for our population of 100,000, this is how many kits we need, as you and Layla have both mentioned, then we also have to think about, if ours differ, do we have to procure additional individual products for some of the health conditions? And then at the same time, if our incidence might be lower, then we have to expect that we will have extra products for that treatment. And then we might have to say, how are we going to manage those extra products? Or we accept that we're going to have some that will go unused. Another big challenge with the kits is that obviously you've got a variety of products. You might have 20, 30, 40 products. within the kit, each of those products can have a different expiration date. And so what's the impact of that? You have to, again, plan for that. The products that are going to last longer, you don't necessarily need to add to. The products that are going to expire sooner, you might need to procure additional of those products. So those are really some of the challenges and the things that we see with the kits.
Thank you, Greg. Yeah, I think we're all touching on the fact that sometimes these emergencies can go on for a while, and how can we deal with that and transition to a situation where we're not wasting too much product or have less than we need. So, Greg, can you just give us a quick overview of what people can expect from the webinar and where the resources are? Thanks. And that way people can follow up and learn more.
Okay, absolutely. So just really quickly to give you a summary, it was a series of 3 webinars on quantification. The first one covered more of the forecasting aspect, planning for a quantification exercise and doing the forecasting. The second one, we focused really on kits and gave a lot more information about the kind of kits that are available and the issues related to managing kits. And then the third one, like Layla said, the part that's oftentimes forgotten in the process is the supply planning. So planning when you're going to receive your quantities of products so that you can have a continuous supply. So that's the 3 webinars. You'll get links to those. And then for the tools, during the webinars, we also present different tools that have been designed for different elements of quantification, either forecasting or supply planning. These have been designed either by organizations such as ours that provide technical assistance, might be a tool developed by UNICEF or UNFPA or another development partner. And then also I can mention that some of the tools are just simple or advanced Excel spreadsheets, and then other tools are actual programs that are for that purpose. And you'll get and each of the webinars will provide the links to a certain number of tools.
Great, thank you, Greg. The thing I love the best about the webinars was the Q&A. There was really rich Q&A. So when you go into the IAPHL, which is the International Association for Public Health Logisticians, and the Humanitarian Commodities Logistics Forum, you can see that Q&A, or you can ask your own questions and we can add to that discussion. So I really want to thank the speakers and the audience for listening in. Like we said, please watch the webinars. We'll be happy to continue to be a part of this solution, especially in these difficult times. And most importantly, I want to thank the humanitarian NGOs who have been our partner in this project. And really a lot of the lessons that we've learned and this ability to adapt some of these supply chain strengthening approaches to humanitarian has been thanks to their work and their input and their participation in this project. And really, they're the ones at the front line, and we're simply here to support them. And especially in this time where we have so many emergencies happening at the same time, they really devoted themselves to this work. And so we're really grateful to them. And also USAID, the Bureau of Humanitarian Assistance, who supported this project. It's a privilege for us to be a part of this solution in these difficult times. So thank you very much, and thank you to the panel, and thank you to everyone who participated.
Thank you, Nadia.
Have a great day.
Bye.
Bye, everyone. Good luck.